Welcome to the Ascend Growth AI podcast. I'm Nikki, and today I'm excited to welcome Rhonda Nerenberg, co-founder and CMO of Weltrio Health. Rhonda is a leader at the forefront of healthcare cost innovation, helping employers and benefit advisors uncover meaningful savings while protecting the benefits that matter most. Today's conversation is about her leadership journey, the wins, the challenges, how she's thinking about AI and innovation, and the lessons she's learned along the way. Welcome, Rhonda.
Thanks for having me, Nikki.
Yes, it's very nice. Let's start with what is Weltrio and what made you start it?
Weltrio is a cost containment, helps employers manage their healthcare premiums and the health of their employees specifically. So it started about 10 years ago. I'm a registered nurse. My primary specialty was surgery, and I had moved to Eastern Oregon where I was introduced to a company owned by a Native American Indian tribe who was really struggling with increased health costs. Health insurance premiums specifically were going up astronomically, and it was going to put them out of business. Their margins were just not big enough to absorb that kind of hit. And in a kind of Hail Mary attempt, I suggested I come in and help the employees manage their individual health to see if by having meeting quarterly with the employees, managing their health, helping them create objectives or goals to work toward to kind of move the needle on their own health, if we could change it, impact healthcare premiums, specifically the claims. And it was incredibly successful. So the company was experiencing at the time 168% utilization, which means for every $100 the company was paying, the insurance company was paying $168 in claims. So they were losing money hand over fist. And so that's why their insurance premiums were going up so high. And so when I came in, within 9 months, we had their claims under 60%. And the following year, they were under 40%. And so then we took them self-insured and we kept them flat at that much reduced rate for 10 years. And the health of the employees improved dramatically. The culture of the company changed. It was super rewarding to see how, when people are seeing exactly where they are in their own journey, not just health, but in all aspects of their life, and can address the things that are concerning them most, not what somebody dictate that they need to be worried about. You should be worried about your blood pressure or cholesterol, when they're really worried about their kids or how they're going to feed their family. Like, we could just really address the biggest elephant in the room and then work from there to work on health. And it just worked really well. So about a year ago, we decided, let's blow this up. Let's do more than just the grassroots that we've been doing and really take it nationally.
So instead of thinking you need blood pressure medication, it could be, why don't we look at how you manage stress?
Yeah.
And who's your customer?
Well, originally, as I was growing, I kind of had this idea that my target client was about 200 plus employees, one that could comfortably go to a self-insurance model, because that's where my work can really drive savings. When you're in a fully insured model, your premiums are set for the whole year. You're going to get your renewal at the end of the year and determine where you're going next year. And then it's set again for another year. So if it's self-funded, where you're paying claims on a weekly basis, they could see savings day one. If I move a prescription to another source, or if I intervene and move an ER visit to a primary care doctor, that they could really see savings day one. But what I've learned through a lot of trial and error and some great team members, that our smallest employee has 3 employees now, that there's really any size company that we can help. We just have to kind of structure how we do it. So we kind of offer 3 or 4 different products to make sure we're meeting the needs of each client.
So do you partner with companies? Is there a size range that it makes the most sense for you at this point in time?
So there is not specifically a size range now. So the number of employees in a company that we service is vast and covers the whole spectrum. And we partner with many different kinds of services in the industry. We are not brokers. We are not insurance agents. We are not replacing HR, although we certainly help them in taking off their plate all the questions that they were never meant to answer. Somehow, I don't think businesses were ever meant to get involved in the healthcare of their employees, and yet here we are, where there's arguably second largest cost behind payroll is health insurance premiums, and there's nobody in the company who really understands what that means, but they're making big decisions about it. So to bring on somebody who is an expert in the field of insurance and health and medicine and how the system works to look at their claims data, look at the needs of their employees, and meet the actual needs of the employees that are being employed by them is critical. So there's not a specific size company we can't work with.
As a person who just went through open enrollment, I'm very interested in this conversation today. I saw some Facebook posts about thank you, Obamacare, because look at where we are now and what we're paying for our household. I even asked my son, can you please see about getting your own insurance? Because it's cheaper for me if it's just me. And the minute I add you, it like quadruples, where it might be better for us to both have individual.
It is so, there is no other industry that could get away with this. You never go and buy a house without knowing what you're paying for or have it inspected beforehand.
As employees, you feel like whatever your employer chooses is what you have. That's the only option that you have. And as everyday Americans, you have no idea if you even have a choice out there. What would be my alternative? There isn't enough information to allow people to, like you say, buy a different house. Like you just are literally presented, this is the house you're buying, this is the payment that you have, and we'll see you next year.
And the payments are often larger than your house payment. I had a company, their insurance, we've just been like tackling this, trying to figure out how we could help them. Their premium increase that they were going to experience in 2026 was 60%, and it was going to make an employee plus their family covered $5,000 a month. Who even has a mortgage that high? I mean, if you do, you're not worried about healthcare. I'm not sure, but wow. Ended up getting them a 20% savings. This employer is going to save money instead of 60% increase. His employees will go from $5,000, which is what they were looking at, to $1,700 for a family, and the employer is going to cover half of it. So this is the kind of thing we can do with really creative. So when a company comes in as an employee, you get to choose A, B, and C if you're lucky. A lot of companies just have A. And it's like spreading peanut butter across the whole company. You have no idea what the actual needs of your employees are. So we really try to identify what are the pain points for your employees and how can we navigate those. And each employee and each company has a different thing that is going to be the primary driver of their health costs. And, maybe for one company, it's prescriptions. Maybe another company, it's cancer. Maybe some company they are these young families and they want to have babies. Like there's just so many different needs. So we're looking at that and coming up with really creative, out of the box ways to address the needs of each individual within companies. And we're partnering with brokers, fractional HR, or companies that manage health, or PEO, where they provide payroll services and HR services and kind of group together to try to reduce claims. We're partnering with all kinds of companies like that.
Well needed service. Thank you. I feel like I should treat you like a veteran and say thank you for your service. I mean, we need to coin that phrase. That's amazing and very well needed. I know who your customer is, everyone, company and person. It's fantastic.
We haven't gone after the individual, although in our Weltrio, one of our pillars is the individual. So while our clients are companies and as small as 3, our target is the individual. And so just while we're on that, Weltrio is 3 things that I pulled together 10 years ago and saw as the critical needs for delivering these services. The first is, what are your current healthcare offerings and is it a good fit for your company? Are you duplicating services? Are you paying for services you're not needing? Is your insurance plan appropriate for your group? And so first I'm looking at the formation of the plan. The second thing I'm looking at is logistics. How are we going to use the plan? And teaching the employees how to use insurance. You'd be amazed at how many people, especially the under 30s, they don't even know what a deductible or co-insurance, co-pay, max out of pocket is. And they don't begin to understand that until they've thrust into the system and have to figure it out and are stuck with these bills and don't know how to deal with them. So we're helping them. And right-sizing care. If somebody has a sore throat, I'm going to make sure they're calling Teladoc. And if they have a rash, I'm going to go to primary care. I'm just right-sizing care. And then I think if we could just drive traffic, just really logistically maneuver things in the healthcare system, we could easily cut costs in half and without limiting the care, just by going to the right place for the right thing. And then the third, which is what we already talked about, is that 100% personal touch. In an age where everything has an app or there's AI or there's a website for that, and the individual is kind of on their own to to figure this out. We are the opposite. We are focusing a lot of time and energy one-on-one, trying to be with as many as possible instead of as few as possible for as long as we can, so that they feel seen and heard and understood, and then help them. They establish trust, and then we can really start moving the needle on what's important to them, which is not what is important often to a doctor. Everyone has different, you have to do the hierarchy of needs, right? Sometimes you have to help people breathe before you decide what they're going to help eat. That's just things that we have to consider.
What do you at Weltrio, over the last year, as you think about it, what are your biggest wins or your greatest accomplishments that make you smile today?
I had a great win last night because my husband was like, "How do you feel?" Because I've just been working on this for kind of pulling the pieces together to try to find the right plan for a specific group that had some unique needs. And knowing that the families really couldn't afford to pay $1,000 towards healthcare, and many of them had gone without healthcare before we came on scene. And with the changes in the ACA credits, these families were going from not having to pay anything because the employer was covering part of it to now they're going to have to pay $1,200. Like, they would opt not to have insurance, and that's not a good place to be in. So it all coalesced last night, and I was like, okay, I got to figure it out. And I called the COO of the company and said, all right, here's what we're going to do. And they were so relieved. They're like, okay, I trust you that you've done the homework. This is a big decision. They're making a $500,000 decision. But I know that you've done the homework and this is going to be the best plan. Let's sign up. So it was exciting. I knew that the most that anyone was going to pay for a family was $300. We were going to have no copay, no max out of pocket, no deductibles for this cash centric plan. It was just exciting. And to present that to somebody who was like, "Ugh, what are we going to do?" It was fun. I love doing that. So I'm excited to now go through open enrollment and present the plan to the employees, face-to-face, one-on-one open enrollment with every employee, not, log into this and click something that, like, I don't know what to pick to help. And I'm excited to tell them about it, to teach them how the plan will be different and how they're going to use it. I'm just excited.
What has been some of the biggest or toughest challenges that you've had to navigate as a leader in this space?
I think that you might be surprised at what my toughest challenge is. So if we were talking about cars, and healthcare is something that you have to buy, even if you don't want it, even if you're not going to use it. So it's like being in a really bad lease in New York, and you're like, oh, this is just such a crappy lease, and it's a crappy apartment. I don't even want to stay there, but I have to pay for it. In December, somebody comes and says, hey, rates are going up. Your rent's going to go up 25%. And you go, oh, okay. And you sign the dotted line. There are thousands and thousands of options but it means you have to move. And my single biggest challenge is helping a company. This is going to be a better plan. Yes, people are going to be frustrated. Nobody likes to move. But I promise, give it 2 months. Let me handle all the frustrated people, and it will be so much better. So actually getting the leaders in their spaces whose job it is to make sure that the employees are happy, to feel comfortable enough to say, okay, I'm going to uproot and move 400 people is my largest obstacle.
Does that take months in advance to emotionally prep them for that?
It does. And yet nobody's looking at it until October. And then they have this pain point. They get that renewal letter. And now I just am surprised at how many people go, I'm just going to stay in this crappy lease and take the hit because I don't want my employees to be upset. They're going to be so much happier once they've moved. That maybe I just moved my daughter last weekend. Moving is terrible. Nobody likes to move. It's messy, the boxes, the disruption to your household, trying to help somebody. But Weltrio is literally the moving company, and we're going to help you get settled and unpacked on the other end. And we're going to teach you about your neighborhood so that you know where all of your services are. We're going to help you find a new provider. We're going to help you find where to get your prescriptions. And ultimately, it's going to be so much better. Make that decision to let me help your employees move. Such a fear of disrupting the apple cart. They go, we're just going to stay. And what's surprising, unless it's a small company, I talk to the C-level people, the financial officer, the operations officer, even the executive officer, and they defer to HR, whatever HR wants. This company I talked about, who they were facing a 61% increase to their insurance. They negotiated it down to a 35% increase, but this was $500,000 more per year for their group. And their broker, and I love brokers, But this particular broker was working on a percentage. He just got a $50,000 raise. Where is his motivation to move your group? And I presented, my recommendations were lengthy and long, and I can help. And this is going to be so good for your employees, but I know there's a change. And dang it, they opted to go with the 35% increase and a crappy plan where they have a high deductible. Like, it was sad.
What do you feel sets you apart as a leader? I can already tell what sets you apart as a person. You're very caring and you want the best for people and you want them to be informed and you want to help. But as a leader, how do you feel like you're set apart?
So I do find myself as a leader, and it's not a comfortable place for me to be in. I don't like to be in charge. And it is that I care about. I really care about the individual. What I want most for anybody that I'm working with is for them to feel like seen, that we can take a pause and just be present without needing to do anything. And I can say, wow, that feels really heavy right now. Thank you for sharing. And just sit with that for a minute, because people don't feel seen. They just don't. And when somebody actually sees them, their heart like wants more. And then they start to ask questions. And if I have a goal going into any meeting is to the hope that who I'm working with gets to a point where they are actually asking questions that they care about, then I'm like, we're golden here, because they feel seen and safe and address what is keeping them stuck. And how can we just help them see that there's a wiggle there and help them work their way out of whatever situation they're finding themselves in? One of them is health, but that is just one of a whole spectrum of things that people are dealing with. And it's often not a priority, as evidenced by how we utilize healthcare.
Which is actually incredibly true. And people there, you get a completely different person when they feel heard and when they feel like their opinion matters, or that they even get a vote and not that things are just happening to them. We try to establish that in our kids young on, and then you get up into your adult world and you're almost starting all over again in that role as an employee where it's happening to you yet one more time, right? How do you personally think about AI right now, and where do you wish that it were helping you more in this business?
So I am a fan of AI. I see it as an incredibly powerful tool. I see it changing how we employ people, and that we're going to need to rethink and retool how we use people to be employed, because some jobs are just going to go away because of AI, and that's a little scary. But it is an incredibly powerful tool. It does not replace the human touch, though. And so I feel pretty comfortable knowing I'm going to have a spot to do something, because that's my primary goal, is to help people bring the wall down, at least in one spot in their life for a minute, and share what's really going on. I find AI in the medical setting to actually be creating some problems. I have a son who's an ER doctor. He's only been at this for about 2 years. And he's like, Mom, they are just really driving the desire for the providers to use AI and with the patients to take notes to help them chart. And he's like, but if I bring AI in, if I'm recording the conversation and the notes are created, that's great. Like, cool. So it's super simple, but I can't focus on what's really important. So in an ER, you are just working on what's acute. They're not working on anything chronic. They just, what's going on today? How do I keep you from dying? How do I get you home safely? So if somebody comes in and they've broken their foot, that is what they're there for. And if they happen to mention that they've had this cough for 5 years, that's not why they're there. But because AI picked it up, they now have to address. And it's slowing people down, and it's costing us more money, and it's important, but not in that setting. And it's so my son, like, I'm going to hold out as long as I can, because I just want to work on what actually is they're there for today. He personally is not interested in helping them with their 5-year cough unless it's preventing breathing right now. That's not his goal. And I go, that's going to change things.
What part of Weltrio's impact do you wish more people understood?
I think COVID really messed up our need for community and created an anxiety in us that was real. And then by acting on that anxiety, so the anxiety was people are now dangerous. I might get something from them. And so we acted on that by staying away, which reinforced in our own nervous system that people are dangerous. And so it's created this pretty significant health crisis as far as anxiety and socializing that we're having a hard time getting over, going back to let's gather. We're doing it, but there are a lot of people with this anxiety that was reinforced through COVID that people are dangerous. It's hard to, and try to convince the nervous system that you're safe. So I think if I could reinforce one thing, it's let's get back to spending time, like time that isn't accomplishing something. Let's just spend time being present and quiet and listening where everything's so fast.
If you could fix one problem in the insurance world, what would it be regarding benefits?
Regarding benefits, there's so many problems. There's so many problems. We've lost track of the parts. I was just listening to a book when insurance was first introduced, and it was $6 a year for a hospital plan. $6 a year. This statistic, I literally heard this today. For every one provider, there are 100 people supporting that provider in some way. Claims, billing, admin, nurse, 100 people. The broker, the third-party administrator, the pharmacy benefit manager, the person who owns the pharmacy, the person who's selling the drug at the pharmacy, all 100 people to support this one provider. The problem is every single one of them getting paid some percentage. It can be really small, but we're paying for those people to support the provider in some form and get all of the mess and the hands in the pot trying to find a dollar. It's just inflated it so much. Like the doctor costs, to sit down with a doctor one-on-one should have a monetary price attached to it. The United States spends 10 times more than any European country on the same healthcare for worse outcomes. It's too many hands in the pot.
What habits or mindsets have helped you stay grounded as a leader, especially in a fast-moving and often high-pressure field?
For me, it's when my computer turns off at 6 o'clock at night and I go back to what matters, which is my family. That keeps me grounded. Just keep my eye on what's really important. I have 5 kids. They're all grown and launched. My youngest is getting married next month. But 5 years ago, I inherited 5 kids who were all younger than mine because of the death of my sister. It just changed how I saw what was important. And so now, I now have grandkids, but I still have 5 more kids to launch, and they need a proxy mom, and they need human touch. They need time. That's what really matters.
And I celebrate you for your gain, because now 5 more people are going to have an amazing life for you being a part of it.
It's crazy. 10-kid family, but now 5 in-laws and 4 grandbabies, and it's a household. That's what keeps me grounded.
I'm sure you're incredibly blessed as a result of it, because with all of that comes amazing blessing with the sacrifice. That is for sure. Can you think of one problem in the last few years that you've had to accomplish that most stands out for you?
Well, to take this away from business, it would be inheriting 5 children. That was way more than I anticipated when it was like, we have to move. We've got to go start over. My youngest was 17 and my sister's oldest was 17 and the youngest was 8. So we had to choose to start over. We now have science projects and choir concert, just all the things I thought I was done with. Every holiday looks different. You're dealing with the grieving, mine and theirs, and my own kids being like, why do they have to be here? What does this mean for us? And everything changed. It's been really hard. So it's business related, but that just stands out. Luckily, my company was well established here and I was able to move because it just made more sense. We were in another state. It made more sense to move to them where they could stay with what was familiar than to move them to us. So the only thing that didn't change was my job. So it was actually kind of nice to have.
When you think about your influence in the industry, what impact do you hope your work has on other leaders?
I still have to put my mind into the frame of I am a leader. I'm often surprised myself as we launch, as I've gotten a whole team. I have a whole team of marketers and coaches and nurses and that help support me, which I didn't have initially. And I am often with my chief operating officer. I'm meeting with them all the time and they're trying to pull things off of my plate. Let's actively create some things. We're using AI actually to try to pull some things off of my plate. And he'll say, I get calls every day from, the salespeople and they're like, oh, I had this question. I called Rhonda and he's like, no, don't call Rhonda. So my COO is actually creating They're calling it a Rhonda bot. They're trying to create an AI that it'll take a couple of years to develop that can answer the questions that I would answer. And so what shocks me as a leader, I guess, is that I do have learned and am an expert in my field, and I have a unique skill set that I bring to the table that people do want to tap into and ask me for my opinion. That surprises me, and I'm trying to step into that, even into like a podcast like this where I'm like, Niki does want to talk to me. I just was really comfortable being a surgical nurse. I loved it, mostly because my patients were asleep. But I'm learning that I can be somebody who people have look to and want to learn from.
I don't think you should underestimate your natural ability to give other people courage to make decisions, because the way you come across allows them to feel heard. And I think they let barriers down, and they're more courageous to do that when the component that comes naturally to you is introduced into the conversation. So I will give you that today, because in just observing you, you're more powerful than you know that you are. And it's because of how humble and kind you are in your approach. And then the knowledge that you have with it puts them at ease to be able to listen, talk, let you respond, and then giving them the information to be able to go forward. I've actually enjoyed talking to you, Dave, because you're the epitome of what the insurance and medical world needs to have to be a part of it, to help us get out of this debacle that we are in right now, that all employees across the nation and employers are facing, especially right now because it's in renewal time and it's just so in our faces. To everyone, it's in our faces. And we're trying to figure it out and how to navigate it. Rhonda, this has been wonderful. Thank you so much for sharing your story and your leadership perspective with me today. I would be honored to feature you on the Ascend Growth AI podcast and highlight the incredible work you're doing at Weltrio. So thank you.
Thank you. It's been my pleasure.
That's it for today's episode. Thank you for joining us. And if you got value from today's conversation, please like, share, and don't forget to subscribe. We'll see you next time on Ascend Growth AI podcast, where we mix smart growth moves with a little AI magic.